An acoustic neuroma is a benign tumor that grows along the path of the hearing imbalance nerve, specifically the vestibular nerve. The more appropriate term, or the better term, is probably vestibular schwannoma, because these tumors arise specifically from Schwann cells, which are responsible for making the covering of nerves. Most causes of acoustic neuroma are sporadic, and we think that they're related to changes on a gene, specifically chromosome 22. We don't know exactly why these changes happen, but they eventually lead to uncontrolled growth of Schwann cells. For a really small percentage of patients found to have a vestibular schwannoma, it's related to an inherited condition called neurofibromatosis type 2, which is caused by a genetic change on chromosome 22 that's inherited. These patients are often found to have vestibular schwannomas on both sides of the head, meaning from both the right and the left vestibular nerve. Acoustic neuromas are not inherently dangerous. They're benign tumors, so unlike cancer, they have no risk, or essentially zero risk, of metastasizing. We also know that they're very slow-growing tumors if they grow at all. If they grow, they're growing on the order of 2 to 3 millimeters a year. And to put that into context, that's less than the size of a pea. Now, some tumors, if they are large and do grow much more than that, they can become dangerous. But that's a property related to the location of these tumors. I tend to say these tumors are in a tricky location, at the interface of the brainstem, the cerebellum, and the internal auditory canal, which is the canal that holds the hearing imbalance nerve. If we saw one of these tumors on the skin, we would probably just remove it. But because of that tricky location, we try to be conservative in order to protect those surrounding structures. An acoustic neuroma that goes untreated might not be a problem at all. Untreated acoustic neuroma might be a management option that's discussed at detail between a surgeon or a neurosurgeon or a radiation oncologist and a patient. One of the treatment options or management options of acoustic neuroma are surveillance or observation, and this is done with MRIs to monitor the size of the tumor over intervals, perhaps every 6 months or every year. But if an acoustic neuroma is diagnosed and then goes unobserved for a period of time and does grow to be a large tumor, it could impact the brainstem or the cerebellum, leading to intracranial problems, particularly high spinal fluid pressure in the head, problems with balance or walking, difficulty with speech, and of course hearing loss and facial weakness.